Chang Ching actually speaking to us and telling
Yeah,
us
yeah, the
what is
beautiful
the
letter from
situation.
Chang. Yeah.
Beautiful. And reminding us that what happened 2,500 years with the quack doctors.
He says, sir, we are coming here to learn herbs from you. Okay, where is the herbs? Okay, you keep on talking about symptom here and there. This thing, where is the herb? You don't talk about principle. Then I told him, what do you want to be? You want to become a herbalist or you want to become a botanist? Okay, you must understand the body. Then you must understand the symptom, the problem. First is a problem. Then is a solution. Okay. Then the material, the formula. To solve the solution, the logic, then only then you come to the herbs. Then you become a real herbalist. Why? Because when the herbs not around, we can always get the replacement.
Before we begin, we would like to share a quick disclaimer. The content presented in this program is intended for informational and academic purposes, particularly related to the history and theoretical understanding of traditional Chinese medicine. It is not meant to replace professional medical advice, diagnosis, or treatment. If you have any medical concerns or health conditions, please consult your physician or a qualified traditional Chinese medicine practitioner. Please do not ignore or delay seeking professional medical advice because of something discussed in this program. Your health decisions should always be guided by a qualified healthcare professional.
So very good morning to everyone and welcome back to day 2 of studying the Shang Han Lun, the ancient Chinese text. And we have our teacher, Dr. Lim, with us. Good morning, Doctor.
Yeah, good morning.
Yeah. So, Doctor, yesterday we had a great insight into the preface where we
preface,
heard Chang Ching actually speaking to us and telling us
the
what is
beautiful
the
letter from
situation.
Chang. Yeah.
Beautiful. And reminding us that what happened 2,500 years with the quack doctors could be a possibility even today, because
Today is the
even
same thing.
now,
The quick
same
doctor
thing.
is the same thing. Yeah.
So, Doctor, we want to quickly get into this journey where we will be taking up 10 verses because it's basically the Shangalun is made in verses. So, we will be taking up 10 verses as much as we can, and we will try to cover them in every session that we do. Is that okay with you?
Yeah, it's okay. You see, in all the ancient texts, even this Indian text and the Chinese one, they put into a so-called gata. Gata means verses, or stanza. Okay, so that it's more like a summary. Okay, a summary. Okay, then after that, there are some future doctor. They will describe in full details. Okay, these are the things. That is a commentary. Okay, but today I think we discuss it as it is. We skip the commentary. There are thousands of commentary. You go to there, you get lost actually. Yeah.
So we continue with the session today. So welcome everybody. We have 100 participants and 100 students, and as well as we are live on.
There's some little bit of advice on the study of Shang Han Lun. So basically, we are studying herbs. Okay, how to study herbs? Okay, actually, I have been teaching herbology many times now. Okay, then many people. I'm talking about symptom. I'm talking about the principle. Then at one time, one person is very impatient. He says, "Sir, we are coming here to learn herbs from you. Okay, where is the herbs? Okay, you keep on talking about symptom here and there. This thing, where is the herb? You don't talk about principle." Then I told him, what do you want to be? You want to become a herbalist or you want to become a botanist? Okay.
True.
You just study the herb per se. You will not become herbalist. You become botanist, no? You see, there are so many herbal book in the bookstore. There are so many herbs listing. Have you seen anybody go and read the herbal book and become a doctor? They become botanists, no? Okay. Now, to become a doctor, herb is not the concern. You need to understand the body, Okay, you need to understand the condition. Diagnosis, okay, is very important. Okay, that's why Chang Ching make it into 4 level. Okay, this what they call first the diagnosis, Okay, you need what do you call, four things, no, four leaf, I forget. First, you must understand the theory. Okay, you must understand. Secondly, you must understand the method. Okay, then you must understand how a herbal formula is constituted. Okay. And last, only then you study the herbs. You did the four thing, Okay, not the other way, Some people, they directly go and study the herb, Herb A, herb B, herb C, herb 4, At one time, there's one Ayurvedic conference coming in Malaysia, Then they go and talk. So one of the doctors said that, our Ayurvedic is very good, We can use 30 herbs to treat diabetes, So there's a chairman sitting beside me, I told him, you have 30 herbs to treat diabetes, Then how to do clinical study? Tell me. You use herb A, it doesn't work, Then go for herb B, it doesn't work, Then go for herb C. My goodness, this is not herbology, I told him this is not Ayurvedic, Ayurvedic should not be in that way, And he agreed with me. You keep on talking about herbs, this herb is good for diabetes, this herb is going for hypertension, this herb is going for this and that. You will never become herbalist.
True.
You know why? You say hypertension. There are 20 herbs, 30 herbs good for hypertension, Which one to choose? Which to use? Are you going to use a herb A? Oh my goodness, it doesn't work. Then go for herb B, it doesn't work. Then you become quick doctors,
Correct.
You become quick doctors. This is not the way. So you should understand the body. Okay, you must understand the body. Then you must understand the symptom, the problem. First is a problem. Then is a solution. Okay, then the material, the formula to solve the solution, the logic. Then only then you come to the herbs. Okay, when you study in this way, there are a few advantages. Okay, first, when the herb is not available, you can always get replacement. Okay, like for me, I always use vegetable, to go and replace all the TCM herbs, because in many areas, I don't expect you to get Chinese herbs, Okay, like in India also to get Chinese. Many people, they learn TCM, but they cannot practice because they don't have Chinese herb with them. Okay, then they are not herbologists, we always say that a herbologist is like a kung fu master. Anything that go into his hand will become a weapon. He can say, I can only use this weapon, You please give it to me, When then the weapon is not around, then you cannot fight. There's no such thing, So we as a herbalist, okay, we go anywhere in the world, okay, we find some problem, okay, but the herbs that we want is not around. What you do? Get the replacement. So that's why now to understand the problem is very, very, very important. Okay, first to understand the problem, to classify the problem, then to understand the treatment. Okay, then the formula, then the herbs. Herbs going to the very end, Going to the very end. You see, in the first 10 clauses, Changtu never mentioned about any herbs. Okay, now when you come for diagnosis, okay, there are eight categories you must understand. First, you must differentiate between yin and yang. What do you mean by yin and yang? Okay, now look at metabolism. Okay, when the metabolism is deficient, is yin, negative, When the metabolism is excessive, is yang. How do you know metabolism is yin or yang? You look at the pulse. If the pulse is weak, then metabolism is low. If the power is strong or tense, like guitar string, tense, that means it's excessive, Okay, so normally when it is deficient, you use warm herbs. You do not use cold herbs, Cold herbs always bring down the metabolism. Okay, so when the metabolism is excessive, we always use cold herbs, Cold herbs to this thing, sorry. Yeah, okay. Now, so that cold herbs always bring down the metabolism. So the first thing is the metabolism. Look at the metabolism. Okay, excessive is yang, deficient is yin. How do you know it's excessive? Look at the pulse. The pulse is strong. Okay, and look at the tongue. The tongue is pale light, that means deficient. The tongue is what they call reddish, no? This is a thing. You look at the color, then you know. And whether he's agitated or whether he is what they call a stupor. Okay, when he's agitated or talking very excitedly, okay, then it's young. He sit there, refuse to talk, You ask him 3 questions or so, he only answer 1, and then definitely it's deficient. No? Actually, this one by logic you can know. Go yin and yang. First thing first, no. Secondly, whether it's external or whether it's internal. Okay, the fever. Okay, now Zhang Zhongqing is very, very good in that, Okay, when it comes to fever, he defines what do you mean external fever. That means the fever at the skin, at the skin, at the muscle there. Okay, then what is internal? When the thing really go deep inside, the treatment is not the same. The external, for example, external fever, you can go by induce the sweat, You induce sweating, then the fever gone. Very external. Okay, but if the fever is internal, okay, that time the dehydration already set in. The body dehydrated. How do you know he's dehydrated? Because thirst, no. You have thirst, no. You have thirst, this thing, and agitated. At the time, if you induce something, you may kill him, Because he already dehydrated, you induce the dehydration go further. So you should not induce this thing. Okay, so you must know whether it's external or whether it's internal. So in our system, we make into 6 sections, You see, hexagenous. Hexa means 6. Okay. Now you have external, you have internal, then you have the intermediate, External we call it exogenous. External. Internal we call it endogenous. Okay. The intermediate we call it interogenous. Intermediate. So that you have exo-yin, exo-yang. Okay. Intero-yin, intero-yang. Okay. Then endo-yin, endo-yang. The totally 6 sections. And this section we call it this hexagenous. And this theory first proposed by Zhang Zhongqing. But he using ancient Chinese, Okay, like yang, he used Tai Yang. Tai Yang means the sun, a major yang. Okay, then he used Sao Yang, mean the minor yang. Okay, then he using a Yang mean the bright yang. I don't use this term. This term will confuse many people, So I use exo yang, intero yang, and endo yang. Better the way. Okay, then the yin also he using Tai Yin. Tai Yin means the major yin. Okay, Che Yin mean minimal yin, Then and Sao Yin, okay, mean a minor yin. No, you this does not indicate the position clearly. That's why I put it in my system. I put it endo. This is what you call this exo-yin, intero-yin, and endo-yin.
Yeah.
So these are the. So you know the metabolism, yin and yang. You know it's external or internal. Then you must know whether physically is cold or is warm. You see, lack of metabolism are normally cold. Okay, but some people have fever, So you must be very careful, You have fever. Okay, this is a thing. So it's not under cold category. Okay, cold means no fever. Totally like that one is very risky, That time you should not use any more cold herbs. Okay, when the metabolism is low, we use warm herb, But sometimes we're having fever, So we add a little bit of cold herbs, to check the fever. Okay, but sometimes the metabolism is low, no fever. Or the treatment totally different already. Okay, so they use to differentiate between cold and hot physics. Okay, then lastly, okay, whether it is hydrated or dehydrated, whether the body is dehydrated or hydrated, or water retention. Hydrated means water, but dehydrated, it feels dry, The rib is dry, the throat is dry, the skin is dry, Okay, no ear, no tears. That one is dehydrated. Then the skin are very rough, you can see dehydrated, this is a thing. Then the hydrated, That means like let's say the lung, the lung filled with water, then pending, when the breathing is pending, at the stomach, then is nausea, Then the lower stomach, then the water retention will cause diarrhea. Okay. So that you should differentiate between the body is dehydrated or hydrated. Okay, this thing. So let me summarize. This 8 category is very important. Okay. First, you need to differentiate yin and yang. Can you understand now? Okay.
Yeah.
Low in metabolism is yin, high in metabolism is yang. Okay. It's external or internal. Or is exogenous or endogenous. Okay. Is it cold or is it hot? Pure cold or pure hot? Okay. These are the thing. Then the lastly, is it dehydrated or hydrated? Or water retention. Now sometimes not only water, sometimes blood, lack of blood, or the blood stagnancy, the blockade of blood also. You see 3 things, not only water. The body fruits, 3 category. One is the fruit, one is the blood, one is your body, the fat, and also your colon. Whether your colon are full or your colon are not full. Okay, how do you know that colon is full? When you have constipation for a few days. Then you do for purging. Before you do purging, you must ask the person, how is your stool? If the stool is everything okay, you don't purge, I mean, there's no stool. You purge it, then you're going to harm him rather than teach him. So that's why diagnosis is very important. You know the problem of the body, then we find the methods. I give you one example. Okay, a person having fever and chills. Fever and chills definitely external. Then you take the pulse. The pulse is weak. So this is exogenous syndrome. Okay, what is the method? The method is to induce the herbs, induce the sweats. So the second. So the diagnosis, the theory, then the method, then the herbal formula. So you choose those herbs that can induce the sweating. For example, cinnamon sticks, guizi. Okay, they sing. Okay, but when you induce the sweating, okay, if you over-induce, then it's very harmful. So we put the second herbs, to check the first herb. So the first herb do not go too aggressively, Okay, then we put in the saoyao. Saoyao is a what you call pony roots. Pony roots are cold in nature, a little bit cold. Okay, so you see now you use a warm. This having fever now. Why you're using warm herbs? Because he's having low metabolism. If you use cold herbs, you're going to complicate the whole thing. Okay, then we use a little bit of cold herb, not so cold, pony root, not so cold, to balance the whole thing. Okay, and then normally those people having this problem, the stomach system are not okay. So we strengthen the stomach. So we put the ginger, we put in the what they call the dates, to strengthen the stomach. That is the formulation. Then we call it guizi tang, the cinnamon sticks formulation. Okay. Then suddenly if I do not have guizi, Okay, I am not around. The day when I'm in Ethiopia, where got guizi when I'm overseas, Now then you go to the supermarket, you check, then you have leek, you have onion, okay, leek, onion, spring onion. You can use that to replace guizi. Okay, then you must have something to control the sweating, Then we use tomato. Tomato to replace the pony. Okay, then the ginger is there. Ginger, then they use the licorice and dates, Okay, when you don't have licorice and dates, we use the palm dates. Palm dates, So when the licorice is not around, we use brown sugar. So you see a logic or not? First, you see the problem. The problem is exogenous. The treatment is to induce the sweating. Okay, the formula is guizi tang. The cinnamon sticks decoction and all. Okay, then the herbs are guizi, cinnamon sticks, saoyao, pony roots, this what they call Senjiang Da Xiao, this fresh ginger, jujube, they say, and licorice. And licorice. Then in India, sometimes you don't have all these things, you know. What you do? You go to Ayurvedic, you know, get the compatible one, or we go to supermarket, you know, get this for example, we using lead or onion, you know, to replace squeeze. We using tomato, okay, or amla, no, amla also can to replace the pone. Okay, the sour, then we ginger is no problem. Okay, then licorice and jujube, you know, we using this dates, the palm dates, no, and India you have jujube, you have the small jujube, the bird, no, and also you have this big green jujube. Both can be used. So when the jujube is not around, no, we can use a red apple to replace it. So these are as a herbalist, no, let me summarize. You must go through 4 things, you know. First, do diagnose the problem. What is the problem? Secondly, what is the treatment? Thirdly, what is the formula? Fourthly, you know, what is the constitution of the formula? Okay, then you become a real herbalist. Why? Because when the herb is not around, we can always get the replacement. Otherwise, you just become a botanist, no? And many people, they are very recalcitrant, no? They only want the formula, no? They only stick to it. They don't want to change. I've seen this kind of doctor, no? If you're in Malaysia, no problem. You can go to pharmaceutical, but you're in India, a big problem. I've seen a few Indian doctors come to see me. They practice TCM, you know, but they told me they cannot practice because they don't have the herbs. I said, no, you don't study well. You study well also, even the supermarket also can become your pharmacy. Your kitchen also can become a pharmacy. Okay, so that's the difference between a real Kung Fu master, okay, and someone who simply practice without understanding. You need to understand. Okay, I think in the first 10 counts, there's no herbs, no? Okay, so those who are eager to learn herbs, no, don't get disappointed, no? What you're learning is very important. Let's go in.
Yeah, so I think Doctor has very nicely summarized that we are going to first understand what the theory is. We have to understand the theory. Then with the methodology, we can understand what method have been used to understand and the whole thing. Then how is the herbal formula made? These are masters that have made it. But at the end, the herb is still that independent choice that the last you as a herbalist will have. So remember, the herb is a dynamic part, but the theory cannot be dynamic. You have to have that fixed. And that's exactly what we're going to study today. Okay, I think, Doctor, you beautifully put in the yin and yang also. I think it becomes easy for us to understand yin and yang because for us, like, we are not used to yin and yang. But now we know yin means low metabolism, yang means high metabolism. And when you have to find out yin, it's the pulse that I can use my fingers to check. If it is weak, yin. If strong, it is like guitar,
strong or tense.
Strong or tense?
Yang.
Okay. Yeah, you should know the herbs when we will study. We'll know the hot herbs, we'll know the cold herbs. This is good to know. Then we will also be seeing the tongue, and we'll have different things. We'll look at different aspects as Doctor teaches us. Tongue, if it is pale and light, that means yin. And if it's reddish and inflamed, it is yang. Okay, then we have to see the excitement of the person. If he's completely dozed off, you're asking him question and he's answering one question after 10 questions of yours, you should understand this person yin. If he's answering, you ask one question, he's talking 10, then it is yang. Yeah. I think, and also very important about the water regulation. If your person is dehydrated or he is extra hydrated, means he is that you have to check on. And if you can understand this, then we'll be able to classify these whole things into the system that Doctor said is external, internal, and between these two, if you don't understand, put something that is internal.
Intero.
So exo, endo and intero. This is how. And now we studied yin and yang. So put yin and yang into exo. Exo, you have exo yin, exo yang. You have intero. You have endo yin, endo yang. Then you intero yin, and inter-yang. I
Yeah,
think
yeah.
this
Six
is the
section.
most simplest six-section hexagenous system that we will be studying. To start with, let's take with the first 10 verses for today.
Yeah, yeah, yeah.
Okay, so this is Shang Han Lun. We are studying translated as it is. Okay,
Yeah,
this
yeah.
was translated on January 28, 2026, compiled and edited by our very own Datuk Dr. Lim Siaojin. Okay, let's begin.
Yeah.
Differentiation of exogenous disease. This is the Taiyang disease. Pulse, manifestation, and treatment. The upper section. So this is
Yeah,
the first category in which these verses were kept. Okay.
yeah, yeah, yeah.
So the first one, exogenous disease, the Taiyang disease is characterized by a floating pulse, headache, stiffness of the nape, and aversion to cold. Notes, Taiyang greater yang mean the sun and refer to the exterior part of the body, nape, the hair, back of the neck. Yes, doctor.
Yeah,
So, doctor, I think the screen is also, your video is also freeze, but we can continue.
yeah, yeah. Because this iPhone after 1 hour something is wrong, no? It become very
Yeah,
hit.
yeah.
Yeah, yeah, yeah. Okay. So now can you hear me?
Yes, we can hear you.
Only the video is not
Yeah,
moving, no?
I don't know.
Yeah,
Wow,
yeah, yeah.
how.
Yeah, yeah. But never mind. So now what is important is that okay.
Hmm.
Now this exogenous disease Taiyang. Taiyang mean but never mind, you can hear my voice, eh?
Yeah.
Okay. I keep on talking. Now Taiyang mean major yang. Actually major yang mean is external. External disease, no? External disease, you must one thing is that floating pulse. What do you mean by floating pulse? When you touch the pulse softly, you can feel it, it's all floating. When floating mean it's something that is external. When you feel the pulse, it's not feeling it much, but when you press the pulse, only thing that you get the pulse, that one is deep pulse. Okay? That is very important. Then headache, headache, stiffness of the neck becomes stiff, Okay? And what is important is aversion to cold. When a person having headache, the neck is stiff, then they have aversion to cold, then it's exogenous.
Okay.
Okay. Then how do you know it's yin and yang? Then go to the second one. Go to the second one. Yeah, yeah.
In the exogenous disease, if there is fever, spontaneous sweating, aversion to wind, and a moderate pulse, this is Yexo-ing.
Yeah, yeah. Exogen.
Zongfang or Zong refer to being attacked. Fang mean wind or external factors. Yeah. Yes,
Zhongfeng
doctor.
mean attacked by the wind. Wind mean external. Wind mean external. Okay. So that you see, now one more thing, spontaneous sweating. When your metabolism is low, it cannot control your fruits, no. Then it always cause sweating, frequent urination, and diarrhea. All this mean low metabolism.
So when you say sweating, you're including, doctor, the urine also and diarrhea also?
No. Here is refer only to sweating.
Okay.
We are not talking. No, what, I give you a general statement, That means if a person has spontaneous sweating, okay, low in metabolism, or he is suffering a frequent urination, also low in metabolism. He is having this loose motion with a lot of liquid stool, they are also low in metabolism. But here is only talk about sweating, Don't confuse with frequent urination.
Understood.
Because the treatment is not the same. Just spontaneous sweating, aversion to cold is this thing, and moderate pulse. The pulse depends on if the pulse fast means fever.
Okay.
Fast and slow nothing to do with yin and yang, no. It's the strength. They mean the weak pulse. Okay, so this is how we decide the exogen. Is it very clear? One very important is the wet skin. Remember, wet skin. When it's dry skin, then normally it's yang.
Okay.
Yeah. Then what do you call? Then he defined the exo yang. The third one.
Okay.
Yeah.
Third one.
Yeah,
Okay.
yeah.
Now in exogenous disease, Taiyang disease, whether there is already fever or not yet fever, there must be aversion to cold, body pain, retching, and a pulse that is tight in both yin and yang. This is called exo-yang.
Yeah,
Now,
yeah,
Shang Han, attacked by the cold, here mean exterior pathogenic factors. Yes, please, doctor,
yeah.
explain.
My video still cannot on.
No, but you're there. I am put it on the screen. Hey, you are
Yeah, yeah,
on.
yeah,
This is better, huh?
yeah, yeah. You see, what do you mean by yin and yang pulse? Okay, when you put the three fingers on your pulse, okay, the upper finger is a yang, the lower is yin.
Okay.
Okay, so you put three fingers, no? The one near to your thumb is yang.
Okay.
The one further away from your tongue is yin. Okay,
Hmm.
so the one near to the thumb is the inch pulse, inch pulse or the chun, and the one away from the pulse is the foot pulse, the che. Okay, so that you must understand the meaning of yin and yang pulse. Okay, both when it is yang, the whole pulse become tense.
Okay.
When the three finger touch there, no, your three finger also feel tense. Then it definitely is a yang. Okay, only one finger tense, the other one very soft, no. Then you're very careful. It's a mixture of yin yang. So what do you call? So what is very important is the pulse is tight, in both yin and yang. That means the pulse is tight in your three fingers. When you're using three fingers to feel the pulse, three of them feel tight. That means it's like string, like guitar string. Or boom, 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 very strong. Then this is exo-yang. So can you differentiate between exo-yin and exo-yang now?
Yeah, I think the doctor, the first verse, where we are talking about the characteristic was only talking about exogenous, not about yin and yang, but in general, correct?
Yeah.
The first verse
the first
is
one
telling
general, yeah.
general.
Yeah, the floating pulse, headache, stiffness, this thing, episode to go, then nothing to do with yin and yang yet.
Yeah,
then you
but
go
it is
further.
to do with exo. It is to do with exo.
Exo, yeah.
Yeah.
Then is wet
After
skin,
that,
wet skin and weak pulse.
huh?
Then is yin. Dry
Understood.
skin and tight pulse, yang.
Fantastic. Yeah.
Look at the skin, Look at the skin. Yeah. The dry
Understood.
skin. Yeah.
So
Let's
I
go
think,
further.
I think we'll let the others to summarize. The first verse told us what are the signs of the exogenous, the disease.
General.
General. But general means everybody with this, either yin or yang, they will have a
Yeah.
floating pulse, they will have a headache, they will have stiffness of nape,
Yeah.
they will have aversion to cold. Remember
Yeah.
this. But if it is yang in the exo, there is always going to be fever, spontaneous sweating, aversion to wind, a moderate pulse. This is the yang in the exo. And then when there is already fever or not yet fever, doesn't matter, must be aversion to cold, body pain, retching, pulse is tight in both yin and yang. The whole three fingers are tight. That means it is yin.
And one more, dry skin.
Dry skin, yeah. Dry and
skin.
wet skin, yeah.
This dry skin, no sweat.
Yeah.
No sweat.
Yes.
Yeah. Then continue.
Next slide. Yeah. On the first day of the Shang Han, the exogenous is affected. If the pulse is calm, it indicates that the disease will not transmit and develop further into the body. If there is a tendency to vomit, or if there is restlessness and agitation, and the pulse is rapid and urgent, it indicates transmission into the deeper section of the body. Yes, doctor.
You as a doctor, you should know whether this disease will become worse or not. Will it attack into the body? Will it attack into the body? So that how do you know whether it attack into the body or not? Okay. So if after the first day, okay, if the pulse is still relatively calm, not become rapid pulse, no. Okay, then the patient is not agitated. Okay, then if the pulse is rapid and urgent, okay, then the patient become agitated, then have nausea. You wanted to vomit, that means it's already go into intero already. Then the treatment is not the same anymore.
Doctor, my question here is, when we are talking about exo and endo.
Endo, yeah.
So these both through which there is disease that can enter the system, right?
Yeah.
Yeah, and when it goes deeper, you're meaning it goes intero, right?
Intero, yeah. Then you start to feel, then you say, for example, the water is congested inside your stomach, the intero. Then you feel nausea, no? You feel nausea. You feel nausea and what do you call? Then or suddenly you have this diarrhea. Diarrhea, no? Diarrhea also is it can be intero.
Intero, correct.
Yeah.
Yeah, let's go on the fifth verse. On the second or third day of the pathogenic disease, if signs of endogenous or enterogenous are not seen, it indicates that the disease has not been transmitted into the body. I think it remains exo. Okay.
What do you mean by endogenous? When the fever is there and without cheer, then the endogenous. Pure fever, no cheers. Okay. And if the fever and cheers are intermittent, like the malaria, no?
Malaria.
Okay. Sometimes fever, then sometimes cheer, sometimes fever and cheer, then this is intero. Okay. So you check. At first, the patient come to you. Oh, he feel chill, no? After 2 days, the chill disappear, no? That means you must be very careful. The disease already go intero already. Go inside already. Okay. Then if you cheers and fever, cheers and fever intermittently, you know, then they are intero. So this is, you as a doctor, you should be able to understand all this.
Yeah.
Yeah.
Okay. I think
my video still cannot work, huh?
I put you on a different your whole screen. I put a video. Maybe you try this, Ajay. You can remove and see if you can have only the section.
Oh, you make me as a host?
Yeah. Can we make Doctor the host?
Now the video disappear. But never mind. We will continue.
No, Doctor, see if he has made you the host. Check. Let me check if I can do you. No, cannot make.
Yeah, this I new iPhone. After 1 hour, phone become very heaty, you know. Yeah.
Okay, Doctor. Let's take.
Yeah. Come to number 6.
Number 6. Okay. Yes, I think this was a long one. Okay. If exogenous disease, if there is fever and thirst, but no aversion to cold, this is called warm disease.
Warm disease, yeah.
If after inducing sweating, the body becomes scorching hot, it is called exo-warmth.
Yeah.
Doctor,
now you see, when the thing is exogenous, no? Okay. When there is thirst, no? And no aversion to cold, that means it's inside, it cannot be exogenous, no? It cannot, that means you say that exogenous is wrong. That's called warm disease. Warm disease is not exogenous disease. Okay? And this is contagious disease.
Oh, okay.
Contagious, that means you have some virus, you have this thing, you know. Okay? Secondly, you know, after you induce sweating, you know, the body become very hot, you know. Okay? That mean you wrong treatment, you know. It already dehydrated, you induce sweating, you know, the dehydration become more serious. Then the body becomes very hot, you know. Then you know, oh, this treatment is wrong. Actually, these quick doctors, no? Okay? They put the patient into the sauna to induce sweating. After that, they become more heat, you know. You have a lot of quick doctors around. You understand? When people come, then they put it into the sauna to induce the sweating. Okay? So then continue.
Yeah. When the wind warmth is the disease, the pulse is floating in both yin and yang. There is spontaneous sweating. The body feels heavy. There is much sleepiness. The breathing through the nose is making snoring sounds. Speech is difficult to produce.
Yeah. Stop here. Now, this is not exogenous. Even though the thing is floating, you know. Why? Because the body feel heavy. The body feel heavy. Feel heavy means it's a water retention. What do you understand? Okay. And there's much sleepiness, no? It doze off. That means it's internal problem. When a person doze off, it's internal problem. It cannot be exogenous. Exogenous, you don't drip into sleep.
Okay.
The breathing making noise. No? When you breathe out, the kind of asthma sound. No? And then difficult to speak. Then They mean internal, no. This is internal. So this is not exogenous problem. If you treat the exogenous problem, no, it's a wrong treatment. Okay, continue.
Yeah. If purgation has been applied, there will be difficulty in urination, inhibited urination, fixed staring, and loss of control of urination.
Yeah,
If
stop here,
fire
stop here.
has been applied, I'll stop. Yeah.
No, this is quack doctor, no. First they apply sweating, you know. Then it doesn't work. Then they apply purging. Okay? Purging doesn't work, then they apply fire. And they continue. See, you apply fire.
If fire has been applied, there will be slight yellowing. In severe cases, it is like fright and epilepsy with occasional spasms. If treated incorrectly by fire, first such wrong treatment may prolong the days. A second and a repeated maltreatment is fatal and can cause death.
Cause that. You see, now the quack doctors, there are three stupid things that quack doctors always do, you know. First, induce sweating. Either induced by killing herbs, or you put you into the sauna chamber, you know, to induce sweating. It doesn't work. Okay, they say, oh, we need to detox the body. Then they induce purging, you know. It doesn't work, you know. Okay, then they put in the infrared, they put in the warm, you know, then they apply fire. 2,000 years ago until 2000 today, this quack doctor, they're still the same type of quack doctors. So you have to be very careful, you know. Okay, with all this quack doctor. I think this Zhang Zhongqing work them properly, you know. These are the thing. So if you have to be very careful with sweating, okay, with purging and apply of fire, you must look at the symptom, you know. Whether this thing apply. If a body is dehydrated, you create sweating, you kill a person, you know. Okay, if the body is already weak, you know, nothing inside the colon, and you induce purging, you know. If the problem is exogenous, you know, you induce purging, the problem will go inwards. Then the diarrhea will not stop. Keep on having diarrhea, then you have that kind of treatment. Then after that, if a person is already dehydrated, the body is already heaty, you apply fire, you know.
Finish.
Even you go to India, the many clinic, you know, they like to use the infrared.
Yeah.
The warm this thing. Or they use the stone, you know. They put a stone, then as you half naked, they put the stone on you, then they say, oh, this is Ayurvedic. Nah, it's not. You look at this Ayurveda photo, always people half naked, no? Then put the heated stone on the back. This is called fire. There's the quack doctor really love to do that now. Be careful about that. Yeah. This quack doctor 2,000 years ago and 2000 today is still the same technique, you know. Same thing. Then they use pendulum to check your illness, no? Okay. They put mystical thinking into yin and yang. Yin and yang, nothing mysterious about that, you know. Under the Zhang Zhongqing, he defined yin and yang very, very clearly. Nothing to do with mystic, you know. Nothing to do with spiritual worshipping. Now you read many of the books that become to yin yang, they become mystic, you know. They talk something that they themselves don't understand.
So, doctor, to just simplify and for my understanding also, we were talking, when we started the chapter, we started to understand what is exogenous disease, and we saw the 4 symptoms, right? We saw the 4 symptoms of first the aversion to cold, there is fever, there is, stiffness in the neck, and there is, and so we saw, body. Saw these 4 symptoms. Now here it is saying that along with that, if there is fever and thirst, then and no aversion to cold, this is a warm disease. It's not the exogenous only. No. So now he's taken us from the common symptom into specific symptom.
Yes, specific,
And he's saying if you treat this specific symptom as a common symptom and give any of these treatments like sweating, the purgation,
after sweating, the body becomes very hot. Wrong treatment.
So when you're practicing, if you do wrong and you see the temperature going up the body, you stop there and you can continue.
Stop here and there. Immediately stop here and there.
Yes.
The treatment is wrong. The sweating is wrong. You must immediately, apply cold herbs, no, to stop the sweating. Like for example, they're using gypsums, no, using bitter gourd, you know, to stop the sweating. When even in a modern meditation, when a person is having fever, dehydrated, you induce sweating, the patient may die, you know. In my village, there are 2 to 3 cases of dead cases, no. We go to hospital and die. Wrong treatment, die, no. Fatal. So that's why I say, one treatment may be prolonged delay, second or third treatment, it causes death. That's a very serious warning as a doctor. Be careful of your treatment. Okay?
You're no more a savior, you're a killer, murderer.
Yeah, you're killing one. Yeah, you need to know who is the correct doctors now. Yeah. There's a correct doctor always do 3 things: induce sweating doesn't work, then induce purging doesn't work, then apply fire. Today you go to many health clinic, you know, they still do the same thing, I'm telling you.
But doctor, this is a very good lesson for everybody who is here, that when you're going through a treatment to anybody, and if he's doing anything of this, and when he's applying, maybe sweating, and your temperature has increased, stop there, even if he wants to continue.
If you have thirst, don't apply sweating.
Yes, you
Just
don't
when your
allow
body
him.
dehydrated, you know.
Correct.
That's why you must always ask whether you are thirsty or not, dry throat or not. So these are the question that you should ask.
I think that's common sense, doctor. When you're already thirsty and you're throwing out water in the bottle,
then of course, then there's another thing is difficult in urination.
Yeah.
If they cannot urinate, then you already lack of water, you know? Then you induce it. My goodness.
No wonder, doctor, they are telling that the signs of coma, like you see the person he's saying here.
Dream the coma.
No, he goes into fixed staring. He'll be like this.
Yeah. They say the eye become stare in front. You see, very nice. No. Anyway, go into coma. No? Go into coma and go into stupor.
My goodness, a simple disease made complicated. Okay.
Yeah. No, you see, what is 2,000 years ago and today is still the same, you know.
Absolutely, doctor.
Yeah, the same theory, you know. That's why we love this because it's applicable even today. Let's continue.
Let's continue. This is getting interesting.
Interesting.
Okay, here 7 verse says, when a disease has fever with aversion to cold, it arises from yang. When there is no fever but aversion to cold, it arises from yin.
It's yin.
Yeah. Arising from yang, it resolves in 7 days. Arising from yin, it resolves in 6 days. This is because the number of yang is 7 and the number of yin is 6. Yes, please.
Yeah. This one you think with a pinch of salt. We don't have. This one is from Yi Ching, you know. Yang is odd number. Yin is round number. This is a thing, you know. Okay. Then because the ancient doctor, they are very good in Yi Ching. Sometimes they apply the Yi Ching theory, you know. Okay. But today, what we need is fever. Okay. You have to be very careful. Okay. There is some yang in it. Okay. So when there is fever, but aversion to cold, but no fever, it's a pure yin, you know. Pure yin. Okay, you don't use cold herbs. You throw away the Savera, no? Savera is cold. Okay, in this case, for example, a person have body pains, stiff neck, okay, no fever, okay, and very, very down, okay. Then we apply the Kui Chu Tang, we throw away the Savera. Okay, Savera cold, you know. For pure yin, you don't use cold herbs. Remember, yeah. But the exo yin, because the fever is there, no? Okay, they use Savera a little bit to check the Kui Chu. Then if it's a pure yin, no fever, okay, then you throw away. In the future, we discuss about that. Today, no need to worry about that. No, when I describe this thing, you just understand. You know, no need to memorize what I said.
Yeah.
When we come to formula, we will discuss it even clearer. Yeah. Let's continue.
Yeah. Verse 8, in exogenous disease, if headache persists for more than 7 days and then resolves on its own, it is because the course of its circulation around the channels and the meridians have been completed. If it is about to enter another channel again, needle the stomach meridian. If the channel transmission is checked and prevented, then disease will resolve. Yes, doctor, please explain.
You see, this exogenous problem normally resolves itself in 1 week's time. They say the common flu. In 1 week's time, think. If you do not treat it in 1 week's time, that means it's not a simple flu anymore. It's a contagious disease already. Let's say you get a cold, everything. These things should dissolve in a week's time. In a week's time, your disease is still there, it's no longer a simple cold already. Then you have to be very careful. When you treat them, you have to be very careful. Okay. Now, in order to prevent it to this thing, we strengthen the stomach. Strengthen the stomach, then you at the foot there, there is an acupuncture point, we call the Yang Ming point, you needle that. Okay. But for us, herbalists, if you don't do that, then we let them drink ginger jujube. Okay, ginger jujube to strengthen the stomach. Okay.
Doctor, what is this concept of this meridian and channels? What is channels?
Meridian and channel, when we come to acupuncture, okay, he divided the body. It's a kind of coordinate system.
Okay.
Okay, then he divided to the stomach meridian, kidney meridian, liver meridian. That one we will do with it in the future. When we go to hexagenous reflexology. Okay. But here, forget about this acupuncture. No. Forget about it. You strengthen the stomach.
You strengthen the stomach. Okay.
How to strengthen the stomach? Okay. Anything sweet can strengthen the stomach. Anything sweet.
Dates.
Ginger and dates. And also the palm dates, the sweet dates. Palm. No, you see when a Muslim, when after the fast, they always take the date first. Why?
To strengthen the stomach.
Because yeah.
Wow.
And the dates can strengthen the stomach very much.
Beautiful, yeah.
And many formulations, you see, they put dates,
Doctor, that means after a long fast, the best way to start is to start with the dates.
With dates, yeah, because it can activate your stomach, yeah.
Okay.
Other than that, you can use the burr, the small dates.
Yes, small.
Burr.
Yeah, in India, very common.
Yeah, and there are two types in India. One is a small one.
Yes.
One is green one,
Yeah, the green apple.
Green apple, normally we take it fresh. But if you dry it, the effect to strengthen the stomach even better.
Oh. Understood.
You dry it, then it becomes chocolate in color. The reddish chocolate, The one is the one we call it the Indian dates, the green dates. The one also very good for stomach.
Yeah.
Then in case date is not around, then you can go for apple.
And doctor, you also told you can use jaggery also if need be.
Jaggery or brown sugar.
Brown sugar or jaggery.
Brown sugar. So that's why when the people take Panadol, we always ask them to take it with the sugar water.
Sugar water, yes.
So that the Panadol would not disturb the stomach system,
Yeah.
Last time when I teach people, many people they don't agree with me. They say we are herbalists, Why shall we use Panadol, the Western medicine? I say you are doctors, Any medicine that's good we use. We don't care whether it's Western or Eastern, Okay.
Correct.
So when we're traveling, you don't travel with herbs. We bring Panadol, we bring everything, So when we find the body is not okay, the flu is coming in, immediately we take with the sugar water. That's why I travel for 20 over years. I seldom get flus. Before I come, we already check it before the thing come, Okay. You should open up your mind, Okay.
Yeah.
Don't be too
rigid.
Orthodox, rigid, yeah. Let's continue.
9 and 10 remaining.
Yeah.
Yeah. When the exogenous disease is about to resolve, it does so from the time C, 9 a.m. to 11 a.m. to the way 1 p.m. to 3 p.m. hours. It means the exogenous healing time is normally occurred from 9 a.m. morning to 3 p.m. in the late afternoon.
This also...
Take with a pinch of salt?
Take a pinch of salt because many Shang Han Lun doctors say that this may not this thing. But normally exogenous problem in the daytime will recover. Not the nighttime. Exo-yang normally nighttime they recover. But night is a yin, So you offset the yang. Okay.
Yes.
So the yin problem is solved in daytime, the yang problem solved in the nighttime. But this not very exactly, So this one you take it with a pinch of salt. Okay. Just read it, It may or may not be. Okay, yeah.
But even then, doctor, I like your logic. In the daytime, the yin going down because of the yang. the
Yeah.
sun and everything, and the
Yeah.
night the yang getting cooled down because of the night.
Yeah.
Beautiful.
Yeah.
Okay. So 10th is in exo-wind disorders when the exterior has resolved, but the disease is not yet completely healed. It will resolve in 12 days.
Yeah. Now, normally, the exogenous problem will resolve in 7 days. 7 days. But some people, their body are weak, It may take 12 days. Okay. So you see, now a person is having problem. You induce sweating, Okay. He feel good, but not very good, Don't worry. In about 12 days, all these things will take care by itself.
Now, my question, Doctor, here is
Yeah.
in these first 10 verses, there is
Yeah.
no mention of any formula. There's no
Yeah,
mention of any herb,
no.
but there is mention of healing that it is taking 7 days. Is that the natural progress of that
Natural.
disease?
They mean even without treatment.
Fantastic. So this is very natural that some diseases just follow the natural 7-day and 12-day pattern, and they can naturally heal themselves also.
Yeah. When you apply this thing in 1 or 2 days, the thing here, you won't take 7 days.
You don't need 7 days.
Yeah, you don't take
Correct.
7 days. Yeah, even sometimes half a day, the thing here already.
So basically what it is trying to say, it's taking 7 days if you don't do anything. But if you do something, it will happen in 2 days.
Yeah, it's a self-healing.
Self-healing. Okay.
It's 7 days, sometimes it take about 12 days.
Yeah.
So
I think
this 10 is important, He define exoyin, define the exoyang, and define the wrong diagnosis. Okay, when the body is dehydrated, don't induce sweating. When the body also water retention, also don't induce sweating. Water retention inside the body. You induce sweating, you cause vomit, It causes vomit. Okay. Now you as a doctor, there's no guarantee that every treatment is right.
Correct.
Sometimes the treatment is wrong. Immediately you know that, oh, this is wrong treatment. Then you give the second formulation.
Correct.
The second formulation will be correct, Okay. Even modern day doctors like this, they give medicine A. Hey, my goodness, it doesn't work, They give you medicine B. Or doctor always do like that.
Yeah.
Okay.
True.
So we try our best to treat. Then from the reaction, we know that our treatment is successful or not successful. Okay, if a person is having some fever, after you induce a thing, the fever become higher, That means your treatment is wrong.
Understood, doctor.
Yeah.
I think today, I think this is good. We can just quickly summarize.
Yeah. So
we learned.
Let me summarize the yin and yang.
Yes, please.
A person come to see you. Okay. So he aversion to cold, having headache, body ache, like the joint pain, muscle pain, also itchiness of the skin.
Okay, yeah.
Here doesn't mention all these are exogenous. Then you start to take the pulse. If the pulse is weak, it's yin. If the pulse is strong or tense, it's yang. Here it doesn't look at the tongue, but also we look at the tongue. If the tongue is pale, it's yin. If the tongue is what do you call reddish, it's yang. You look at the tip of the tongue sometimes becomes reddish, it's yang. Yeah, this is the thing. Then when the body is dehydrated, they feel thirst, don't induce sweating. Okay. Then when after you're treating someone, the body temperature become higher, then you must suspect that this is dehydration. Then you must use something to hydrate the body. Okay, for example, we're using cucumber. Cucumber is very good, to hydrate the body. Okay. Then to remove if sometimes it's a water retention. Water retention, so you cannot induce sweating. Water retention. Okay. So these are the things that you should understand. So in the future we'll deal with that.
Let's take 10 verses at a time. Let's not hurry.
Yeah.
Go slowly, because it
slowly,
is not
slowly. Don't go too fast. Yeah. So I think.
Thank you so much, doctor.
I think I have another meeting. Everything for me.
Sure, doctor.
So we adjourn the meeting now. Thank you very much.
Thank you so much, doctor.
Yeah. Bye bye.
So yes, so please make your notes and keep studying. We'll be meeting again next Saturday and Sunday for our classes again. In the meantime, take your notes. We finished the preface yesterday. Okay, remember in the preface, a very important aspect that Chang Chung Ching had highlighted was that he said that he was very impressed with the physician of that time, whom Benche, I think so, and he said that he could predict the course of illness of the Qi, the king and the monarch of that time, and the Duke of Qi. And he said that if he could predict, he was very impressed with this. That means every doctor should be able to identify the causes that lead to the progression of a disease. And I think Shang Han Lun is exactly that staircase in which you will be able to see how a disease enters from the outside in, and from the inside it goes worst more in, and you'll realize that there are different ways and modalities in which you have to handle it. And so go slow, take your notes, don't hurry to go to the final stage of direct prescription. First understand the concept, remember, and after that we will see how the different herbs that we are going to learn, we can apply that. So again, thank you so much for your time. We'll see you in the next class. Till then, have a great day. Bye bye.
Before we ending, we would like to share a quick disclaimer. This program explores Shang Han Lun for educational purposes only. The content reflects traditional knowledge and personal interpretations, and is not medical advice, diagnosis, or treatment. It follows YouTube guidelines and does not promote harmful or misleading practices. Please consult a qualified healthcare professional before applying any information. Seoul, Sunya Open University Learning is not responsible for any outcomes based on this content.